Thank you for watching this recording on supervision of speech pathology students on a service learning placement. My name is Lucy Zuman. I am a speech pathologist and clinical educator with Three Rivers Department of Rural Health at Charles Sturt University. I'm here to provide information that supports you as the supervisor and to offer a deeper understanding about project placements. So grab your coffee and enjoy the following presentation. Three Rivers is a key initiative of the Australian Government under the Rural Health Multidisciplinary Training Program. The objective of this program is to improve the recruitment and retention of medical, dental, nursing and allied health professionals in rural and remote Australia. Three Rivers is one of 19 university departments of rural health around Australia. Three Rivers is based in the Central West and Riverina regions of New South Wales. Our regional footprint encompasses both the Murrumbidgee and Western New South Wales local health districts and primary health networks. The Rural Health Education team consists of clinical educators from a variety of allied health backgrounds who are located at other Charles Sturt campuses and neighbouring towns within our footprint. The Three Rivers clinical educators are responsible for the initiation, development, facilitation and evaluation of rural clinical placements supported by Three Rivers DRH. The clinical educators act as a conduit between the university, student, host site and clinical supervisor to ensure the placement runs smoothly and successfully. Three Rivers Department of Rural Health aims to deliver high-quality, effective rural training experiences for nursing, midwifery, allied health and dental students. Develop processes to improve rural student recruitment. Engage with the local community to support the delivery of training to students. Maintain and progress an evidence base and the rural health research agenda. Support improvements in Aboriginal and Torres Strait Islander health. And provide regional leadership in developing innovative training solutions to address rural workforce recruitment retention. This presentation is designed to introduce speech pathologists to the process of providing clinical supervision for students attending a service learning placement. It is for clinicians who are experienced supervisors and also for those who are interested in or are new to student supervision. Specifically, this presentation is for all speech pathologists who would like to learn more about a project-focused clinical placement model, how the model is different to a more traditional placement approach, and applying the Speech Pathology Australia Compass evaluation tool to this model. The learning outcomes of this presentation aim to assist you, the supervisor, and your student in becoming familiar and confident in supervising this placement model. Specifically, you will develop an understanding of the service learning placement model, develop an understanding of the role of the speech pathology supervisor in service learning placements, be able to explain the student learning objectives of a service learning placement and facilitate the assessment process used in these placements. You will develop an understanding of how to assess student performance on a service learning placement using Compass, and develop an understanding of how to support students on a service learning placement. Learning Outcome 1. Develop an understanding of the service learning model. Service learning is a teaching model that incorporates interactive learning and community service and engagement with academic study, reflection, experiential learning and social connectivity through the development of a project. This model incorporates the key principles of Vygotsky's social constructivist learning theory, where students are active participants in the creation of their own shared knowledge and experiences for a deeper pedagogical framework of learning opportunities. Universities embed compulsory workplace learning subjects in the form of clinical placements, where students must integrate their speech pathology knowledge and skills and apply these within a variety of speech pathology practice contexts and populations. I want to explain the differences between a clinical placement and service learning placement. The most common clinical placements take on a traditional apprentice-style, hands-on model in a workplace. Students work with clinical educators to develop their speech pathology knowledge and skills. Three Rivers offers opportunities that extend beyond the traditional hands-on placements. We set up, manage, support and facilitate project experiences, referred to as service learning placements, in rural settings where allied health specific services are often lacking. Speech pathology students integrate community service with academic study, reflection and experiential analysis through the creation of a project that is co-designed and created with and for the host organisation. The placement focuses primarily on professional skills and is about identifying a discipline-specific need within a service as opposed to providing the technical or practical aspects of assessment and intervention only. If we were looking at an individual as the client on a traditional clinical placement, we would be focusing on patient history, current health and primary concerns, mental health, quality of life, health risks, their living situation, ability to communicate and associated behaviours, the demographic, family situation and support, and their purpose for consultation. If we are looking at a whole organisation as the client, the scope is much broader, but can still be grouped together. In this case, we're looking at services, staff and stakeholders, patients, the culture, the current resources, their needs and values, the organisation's overall performance, the history, the leadership and management, and their education and training. There are 6 elements of service learning that make it such a unique placement model. Firstly, the experience is applicable to the student's discipline, and they will work with an organisation with limited access to that discipline-specific service. Secondly, it's an authentic model and engaging experience where students work directly within a community. The learning experience is well planned so that the host organisation intentionally benefits from the student's knowledge and presence. It's a form of experiential learning where students are able to connect the theory they have learnt into real-life practice. Reflection is a big component of service learning, where students must embrace the value of problem solving, quality improvement, interdisciplinary connections, and developing the ability to make meaning of personal experience in a learning process. And finally, the students positively give back to the community by sharing their knowledge and addressing a need, resulting in an impactful contribution. So to look at the core details, service learning placements take place in rural locations where there are less services available to the community. The type of host site can vary, but may include a school, preschool, aged care facility, Aboriginal medical service, or private clinic. Students undertaking service learning placements are supported to design and complete a project in their host organisation. If there isn't an allied health professional or speech pathologist working within the organisation, the student is supervised on-site by a professional within the facility and regularly both face-to-face and on Zoom or on the phone by an off-site speech pathologist. As we've already covered, the main activity on placement is investigation, service development and project delivery, all completed in collaboration with the host site, the supervisor and the Three Rivers clinical educator. The topic of the project is usually decided within the first week of the placement. Generally, the topic is quite broad to begin with, and it's then up to the student to investigate deeper into the specifics of the topic and what deliverables they can create to address the identified need. The students are encouraged to engage with staff, explore underutilised equipment, and evaluate current practices, curriculum, frameworks to further inform their project deliverables. In the final week of the placement, students must present an overview of their project, often in the form of a PowerPoint presentation or demonstration. This presentation is a formal handover of the project to the host site and allows the student to discuss how they developed their project and how they expect it to be utilised. The host site then has ownership of the project and all related materials. Examples of projects depending on the type of organisation may include supporting communication skills of kindergarten students, speech pathology tips, tricks and tasks at school, school-based feeding improvement, Speak Easy for learning and living resource, and mealtime management in aged care. Supervision is shared between the clinical supervisor, host site and clinical educator. As mentioned, the clinical supervisor will attend the placement site for 1 day per week and will provide support on the other days via phone and Zoom. The amount of supervision required from the supervisor equates to approximately 6 hours per student per week. These placements are always completed in pairs, so it ends up being 1 day on site with the students and remote communication on the other days. A staff member on site will provide support and guidance to the student on a daily basis on the ground, and a Three Rivers clinical educator will provide support to the student, site and clinical supervisor. Students may find the learning approach initially challenging, as it is quite different to placements they would have already attended. The learning approach is very much self-directed and collaborative. The placement is often less structured to a clinical placement, and students are often left to their own direction. They are expected to develop their professional skills, which does take time. Students are encouraged to embrace all elements of their learning journey and find a balance with contributing and participating within the organisation and working on their project. Project development. To assist in completing the Compass evaluation at the midway point and end of the placement, Three Rivers has created tasks specific to the service learning placement that aid the students in their project development. These tasks are completed in addition to course and subject requirements and must be included as part of your evaluation process. These include weekly reflections and project planning. For reflective practice, students are encouraged to complete a short weekly written reflection using the Gibbs reflective cycle as a suggested scaffold. This aids as a structured debrief to support experiential learning and as a framework for continuous improvement. It's always so rewarding and often surprising for students to go back and read their reflections at the end of their placement to see their growth and how far they have come. Students are guided through the creation of their project through a series of weekly tasks, and Three Rivers provides templates for them to use as guidance. The first week covers the investigation phase. Then they prepare a project brief, the implementation plan, and then they present what they have created to relevant staff and stakeholders. Students must also include all their presentation in a written report for the organisation outlining the project process, findings, resources, recommendations, and contingency plan. Students work on the project within their placement hours and are assessed on their consultation, development, and implementation of the project throughout their whole placement. Moving on to learning outcome number 2, develop an understanding of the speech pathology supervisor role in service learning placements. One of the main roles as a supervisor is to consistently focus on the learning opportunities provided by the project and continuing to consult with the organisation in a safe and competent manner. You help the students educate the organisation on what speech pathology may have to offer that is relevant to their organisational goals and priorities. This may include upskilling health practitioners on age norms for communication development, creating a cheat sheet for preschool staff on school readiness, or providing education to staff offering thickened fluids in a nursing home. The supervisor helps the students identify and value all learning opportunities, which may include the clinical aspects at times, but are also much broader across interprofessional workplaces, professions outside of health, taking a strengths-based approach in rural areas, and working with the local community. The supervisor assists the students to develop a project that is achievable, applies evidence-based theory, and provides education that will improve organisation outcomes. Just on a side note, the supervisor role does not include developing clinical learning opportunities that don't relate to the project. Clinically focused training is not appropriate in a setting where follow-through and guidance is not continuous. The project must not provide a service to the organisation that isn't sustainable once the placement is complete. Learning Outcome 3. It's important to understand the student learning goals and objectives of a service learning placement. Over the placement period, students will be immersed in the culture of both the organisation and the community in which it serves. It is important that students participate in the workplace to maximise their learning and to meet placement and subject requirements. This means being present on site at the host organisation and engaged in activities within that workplace. The goals of a service learning placement are for students to enhance their academic learning through real-world experiences, increase their sense of community identity, provide support to a community or organisation to integrate discipline-specific processes into their services, and support meaningful projects that positively impact communities. For placement objectives, students must develop an understanding of rural clinical practice and the placement organisation, apply theoretical knowledge, participate in immersive activities specific to the community, develop an understanding of the speech pathology role within the organisation and community, develop professional communication, self-management, ethical practice, teamwork, and continuous professional development skills, participate in interprofessional learning, assessment, and reflective practice, develop a program and recommendations, effectively integrate skills in assessment, clinical reasoning, planning, implementation, and evaluation of intervention, and become proficient in project management skills. It's important that the supervisor supports the students in understanding and prioritising their learning objectives. Doing this means that many of their concerns and challenges around a project placement format are addressed in a proactive and positive way, hopefully before they even arise. Students are almost always hands-on, assessment-focused and success-orientated. So acknowledging this upfront and reassuring the students that their placement is highly valuable is helpful. Providing learning opportunities that enable a broad experience and positive evaluation result is something the supervisor can establish with the host site and clinical educator before the placement commences. It's also really relevant to point out to the students that all new graduate speech pathologists have essentially the same skills and attributes to try and sell to their new employers, and that these projects can give them something in addition to that, which will help them to stand out from the crowd. Students appreciate the service learning placement model when they are well prepared and understand the focuses on interprofessional teamwork and project outcomes. They're able to embrace the concept, work together as a team with the organisational staff, and learn from each other. It's amazing to see their professional growth over a relatively short time. While the students may not have a full-time clinical caseload, it is certainly still possible to assess the SPA competencies and their university subject learning outcomes. Which brings us to learning outcome number 4. Develop an understanding of how to assess students' performance on a service learning placement using COMPASS. The Competency Assessment in Speech Pathology Assessment, or COMPASS, is a competency-based assessment tool designed to validly assess the performance of speech pathology students on their placements. Prior to the placement starting and the evaluation of your student, it would be best to familiarise yourself with COMPASS and how it works in general. Chances are that if you have supervised students before, it would have been on a traditional or apprentice-style placement. The COMPASS is complex and time-consuming to complete, so it's best to have a base understanding of it prior to supervising a service learning placement. If you scan the QR code on the left-hand side, you will be taken to the COMPASS Assessment Resource Manual for your reference. If you scan the QR code on the right-hand side, you will be taken to additional COMPASS training and resources. There are 2 sections to the COMPASS assessment: the professional competencies and the occupational competencies. The professional competencies define the knowledge and personal qualities that are considered critical to competent performance in clinical placements. The occupational standards, which will soon be superseded by the professional standards for speech pathologists in Australia, define the minimum skills, knowledge base and professional standards required for entry-level practice in speech pathology in Australia. In the Assessment Resource Manual, you will find detailed information on the professional competencies. There are the 4 units, the elements within each unit, followed by detailed descriptions of the professional competencies and performance criteria for each element. The performance criteria outlined in the professional competency units explain what the student should be able to do at entry level. So, how do the students achieve their performance criteria? And how can this be applied to a project model placement? Because we're focusing on the professional areas of practice, it is a little easier to apply the service learning model to the performance criteria. As an example, I'm going to use Unit 1, Reasoning, Element 1.1, which states, use effective thinking skills to ensure quality speech pathology practice. The performance criteria is included in the manual, so I'm going to focus on what the student needs to do to demonstrate competency based on the performance criteria. I have created a document that explains fairly simply what the student needs to do based on the performance criteria and how that directly relates to the project model. So, what do they need to do to be competent? To break it down, I've chosen 3 core actions where the student needs to demonstrate the use of effective thinking skills for quality speech pathology practice. Complete essential research to learn about the community, the issue, and the project. Well, how do they do that? There are a variety of ways, including completion of the organisational analysis, where they get to know the organisation and investigate and review the overall operations of the business. They must also engage with the community and collaborate to identify their gaps and needs. The second action might be students critically evaluating, interpreting and synthesising information from a variety of knowledge bases. So this would include analysing the findings of the organisational analysis. A third action might be students monitoring their reasoning strategies by reflecting on the accuracy, reliability and validity of observations and conclusions. This can be achieved through the completion of their weekly reflections. There are a few more ways the project can be related to these actions, but I've touched on the key areas. Now I'd like to move to the occupational competencies, which are certainly a little more challenging to apply to a service learning placement. There are 7 units altogether, but I'm going to focus on elements within the units 1, 2, 3 and 4. I've created a similar document to the professional competencies, however there are no performance criteria. The manual outlines examples of behaviours that students may demonstrate at the novice, intermediate and entry level based on the unit element. Next to the unit element, I've written the same information but have adapted it to a project perspective, simply to make it easier to get our head around. I've then stated what the student should do and how, and then the direct relation to the project. Keeping this simple though, we will focus on 4 core actions or behaviours expected of students and how they can demonstrate these. The first unit is assessment. Element 1.1 states, investigate and document client's communication and/or swallowing condition and explore the primary concerns of the client. Clinical assessment identifies and prioritises patient problems. This may be tricky if the student is not seeing individual clients with communication difficulties. If this element was to be written with an emphasis on the client being the organisation, it would read, investigate and document the organisation's service, gap and/or need in relation to speech pathology and explore their primary concerns. Looking at assessment in this lens immediately focuses on how speech pathology has something to offer the organisation, and once a project has been decided, the sustainability of the project outcomes. So what should the student do in Unit 1 to demonstrate competency on a service learning placement? Establish and document the presenting primary need or gap. Identify the significant people, professionals in the organisation, and collate information via the organisational analysis and investigation. So how do they do this? There's a few ways, with emphasis again on completing the organisational analysis followed by a project brief. The next one, develop a comprehensive and appropriate implementation plan for the organisation and community. This can be demonstrated through Appendix 3, the implementation plan. Document and undertake informal assessments to establish further information with supervision. One that stands out to me is students completing informal investigation across disciplines and community via the creation of surveys or questionnaires. And finally, focus on the organisation during assessment and note relevant information arising, which can be demonstrated through areas we've covered above, with some emphasis on the collaboration and consultation with the organisation and community. Moving to the Occupational Standards Unit 2, Analysis and Interpretation, Element 2.3 states, students should determine the basis for or diagnosis of the communication and/or swallowing condition and determine the possible outcomes. In other words, determine the basis for or diagnosis identification of the organisation's service, gap and/or need and determine the possible outcomes. There are lots of actions that the student should do to support this element, but I want to focus on 4 of those. Record, collate, analyse and interpret assessment analysis data with reference to normative or criterion referenced information or other research or evidence and/or test or analysis guidelines. We see again our trusty organisational analysis sets the students up for then analysing their findings and completing a literature review in preparation for a project brief. Integrate information from all sources to ensure a holistic, accurate and appropriate interpretation, findings and plan for further investigation or project brief. Collecting and presenting evidence once a project has been chosen sets up a rationale in the project brief. Project the possible outcomes of the analysis or investigation and provide recommendations. So this would be the implementation plan. And finally, write a coherent and collaborative organisational analysis, project brief, implementation plan, and final report relevant to the needs of the organisation and their context, which also meets the requirements of the organisation. Now this speaks for itself through completion of all the appendices. In the Occupational Standards Unit 3, Planning Evidence-Based Speech Pathology Practice, Element 3.4 states students should establish goals for intervention in collaboration with the client and significant others. In other words, establish project goals in collaboration with the organisation and significant others. To do this, integrate and interpret information to plan service provision in simple or familiar cases. This would be demonstrated through examination of the organisational analysis findings and then further on through the implementation plan. Identify gaps in the current information on the client or organisation and the strategies required to supplement these. Now, this has already been investigated in the analysis. Collaborate with the organisation and significant others to identify several project options and strategies in the context of their preferences and theory, evidence, clinical practice, and available resources. This speaks for itself through the students' collaborative approach with the organisation and community engagement, and then presenting evidence to support their rationale behind the project. Discuss possible outcomes and project options with the organisation and other significant people, and seek support if the situation is likely to be complex. Again, presenting findings via collaboration and in consultation with the organisation. And referring to the scientific evidence that justifies the planned project approach via a literature review. Unit 4, Implementation of Speech Pathology Practice, is demonstrated through Element 4.2. Implement an evidence-based speech pathology intervention according to the information obtained from Units 1, 2 and 3. In other words, implement an evidence-based speech pathology project according to the information obtained from Units 1, 2 and 3. This would be demonstrated through all we have covered, as well as actual completion and handover of the project to the organisation. There are 3 more units in the Competency Standards section of Compass, and I'd be happy to pass on the summarised information covering all the units. Hopefully, though, you've got an idea on how you can apply the learning goals and objectives of a service learning placement and assess competency on this type of placement via the Compass evaluation. There are other areas of Compass that may come up as tricky to assess. Selecting appropriate intervention in collaboration with the patient or client. So we have touched on this, but to reiterate, the students are creating a resource, let's refer to that as intervention, because it's based on the assessment and investigation, for the organisation, who are the client. If students don't engage in the collaboration part with the organisation, staff and relevant community members or stakeholders, then the likelihood of the project having sustainability after the students leave becomes very low. Collaboration means creating something that will be beneficial, but also developing strong relationships with the organisation to instill trust, respect, and excitement for what they will be provided. Discharge planning. Now, this becomes about planning from the very start of the placement and for all that occurs throughout the project development. This is to ensure the sustainability of the outcomes of the project for the client, being the organisation, once the students are gone. Now, assessing joint and individual contributions. It's up to the supervisor to structure student work in a way that allows evaluation of both joint and individual contributions. Demonstrating this through teamwork can be seen through the investigation, the presentation and final report as determined by you. It's also helpful to have the students complete aspects of the project individually and to observe how they delegate their workload. One way to do this is having the students each develop short and long-term SMART goals for the project. If they complete a literature review as a component of evidence-based practice demonstration, you could ensure each student had a subtopic to complete, which creates an opportunity again for joint and individual assessment. This colourful page of beauty includes all the areas a student can demonstrate competency and how you can assess on a service learning placement and apply to the Compass evaluation. Don't be surprised or concerned if there's a few areas in Compass that you can't complete at the midway review. When you meet with the student, clearly outline how these aspects will be assessed, and the end of the placement report will be a key part of this. That is, integrating key parts of Compass into the report to demonstrate competency. You may also wish to have the students complete case studies to address other aspects of Compass if necessary. Thank you for listening and for building on your skills in student supervision. If you have any questions, would like to speak to a clinical educator, are interested in supervising students, or would like a written summary of this presentation, please contact Three Rivers Department of Rural Health.